Nearly 24 million people across the country live each day with diabetes.
For some, weight loss surgeries can help those patients. Today, Dr. Paul Kemeter is back with us. He's the director of the bariatric surgery at St. Mary's.
And with him today, Dr. Emily Collins and a patient, Sarah McCallum. Welcome to our studio.
Good morning.
Thank you.
First, let's talk about diabetes, because this is so often something that you are dealing with when you have patients that come that have a weight loss concern.
Mm-hmm. So diabetes is a condition that develops when the sugar in the blood is elevated. And as we know, having an elevated blood sugar can lead to a lot of complications: kidney disease, neurologic diseases, vascular diseases. So when it's elevated, it should be addressed and treated. There are two types of diabetes. One, type 1 is the less common kind. 5 to 10% of the population have type 1 diabetes. It's the kind that develops when the cells that make insulin, or the beta cells, fail. They don't work anymore. So it's the patients with type 1 diabetes that need insulin right from the get-go. Type 2 diabetes is the kind that's much more common. So when we talk about our diabetic population, 90 to 95% have type 2 diabetes. In this situation, the cells that make insulin, by the way, is the hormone that puts sugar away in the blood. In type 2 diabetes, the beta cells, the cells that make insulin, are working very, very hard, but our bodies are resistant to insulin, so the beta cells have to work harder and harder in efforts to put sugar away, and typically fail if not addressed or treated.
Wow. And I know today we want to talk a little bit too about how weight loss surgery can impact diabetes.
Sure, definitely. When our weights go up, when our lifestyle changes and we become less active, when we have a poor diet, our bodies again are more resistant to insulin. Insulin resistance is this key. When we are insulin resistant, our beta cells of the pancreas have to work very hard, make more insulin. With weight loss, through weight loss surgery, through lifestyle changes, insulin sensitivity improves, often dramatically, and diabetes can go into remission, blood sugars improve.
Right. And Sarah here can testify to that. Tell us your story, because you have dealt with this firsthand.
My weight was an issue most of my life. I guess I was maybe more aware of some of the health implications when I had my third child. I had gestational diabetes, and it didn't resolve afterwards. So then I, was diabetic, and I had a kind of a heart-to-heart with my doctor, and he said, you can't ignore the health implications of this. And when I talked with him about considering a weight loss surgery, he said, think about the risks. I said, what about the risks of a surgery? He said, what about the risks of continuing obesity?
Exactly. We're seeing pictures where you were about 150 pounds heavier than you are today. Congratulations. You look amazing.
Thank you.
That is. And since then, how are you doing?
Really well, reinventing life a bit, and trying to stay active, and managing supplements and the things that come with the surgery. But really well. It's been a good journey for me.
Yeah, Dr. Kemeter, let's talk a little bit about the surgeries, because we know every person is different, and so there are different solutions. And how much diabetes plays into your patients' lives and becomes a factor when they're seeking out the surgery or are trying to be healthier?
Right. Obviously, obesity drives a lot of health conditions. We've talked about those over the years. Actually, we've been meeting, and diabetes is one of the scary ones because of everything that Dr. Collins pointed out. It can just drive so many of their health issues, and so the good news is there are treatments, and so there are medical treatments, and then the surgical piece of it, which is what we're talking about today. And each surgery that we do, be it the adjustable gastric banding or the room-wide gastric bypass or sleeve gastrectomy or duodenal switch, as Sarah had, each of those has a certain rate that it helps control the diabetes. And I think the one thing we do have to point out is that we're not curing diabetes here. We are helping to put it into remission. And I'll give Sarah some credit here, because we always talk about how it's not necessarily just the surgery. It's the mindset, it's the behavioral changes. And the weather that we had today, she was out walking already.
Oh, wow.
At 5 a.m.
At 5 a.m.
It probably got an extra workout because it's a little bit harder on it.
Resistant.
So you have some workshops or seminars coming up where people can seek out more information about how they can get healthier and ultimately happier.
Yeah, and the first step always is get more information. And so go online, you can look it up, but we also have free seminars that people can come, and they'll spend about an hour, hour and a half and have their questions answered. And, you know, it's an hour, hour and a half of their time, and they'll get a whole lot of information out of it and hopefully see what options they have.
Mm-hmm. Well, we're so glad that it worked out for you. More people have to get that kind of information and figure out what's right for them.
Yeah, you're changing a lot of lives, so thanks for coming in today and
Thanks for
sharing this
having us.
information. Yeah, congrats, Sarah.
Thank you.
We'll be right back.
This is 8 West.